My name's Zachary Webb. I'm from Lewiston, Idaho, and I'm 41 years old. So I'm down here to have kind of a new procedure done, kind of on my heart, but more on the nerves that connect to my heart. So I'm down here because I have a thing called a neurocardiogenic syncope, which causes me to pass out on a pretty regular basis or have syncope.
We went to my brother's wedding and we traveled to a different state, and we were staying at his grandma's house. I woke up in the morning, I remember, and Zach wasn't there and I couldn't find him. And I went in the bathroom. He was gray in color and he was sitting in the bathtub. I brought him downstairs where it was cooler, and about an hour later I heard another crash, and I went downstairs and he was bleeding, and he looked at me and said, "What happened?"
But that's kind of how erratic it can be, is, you know, everything's going fine and then you're passed out on the floor and you hit yourself and bleeding, and it's just really debilitating, really frustrating, and more so to just have it every month and know it's coming again and again and again.
One of the challenges is just the uncertainty about when Zach is going to be not feeling well, and he really wants to show up and be present for everybody, but there are days that he just might have to be in bed and be struggling with this when he wants to be present with everybody else.
CNA, or Cardioneural Ablation, is a really exciting new field in which we're using ablation catheters, these little tools, to be able to typically cauterize arrhythmias, but we're using it to burn the nerves of the heart. He was out of state and found us from Idaho and reached out to us, and then we did a teleconsult. So this shows you how much medicine has changed, where you can reach out from social media, hear something, do a televisit, and then determine and see that physician if this is the right plan of care or the right approach. And then when we talked about it, he had described that ever since the age of early 30s, he was fainting every 3 to 4 days, full-blown loss of consciousness. We are in EP Lab 7 of Banner University Medical Center, our Cardioneural Cardiology Center, and we are really excited to do a novel type of procedure which is innovative in terms of its strategy. It's off-label and not currently yet approved by the FDA, but it's done on a compassionate basis in patients that are young, that have fainting episodes that are related to sudden drops in the heart rate. And this is called cardioneural ablation, and it's for a condition called vasovagal syncope. So this cardioneural ablation procedure isn't even a surgery. It's a procedure. This is an outpatient-based procedure where we go through the veins of the leg. We thread little catheters that are deflectable up. We do a basic electrophysiological study, which is basically a diagnostics. We're running diagnostics to see if there's other reasons why the heart rate slows down. Are there actual structural problems? If not, we call it a functional problem, which means it's due to a reflex. It's due to the nervous system that's triggering this. And if that's the case, then in that same procedure, then we take an ablation catheter, which is just a tip that delivers radiofrequency energy, and it is a thermal source, and we zap or cauterize those areas where the nerves plug into the heart.
Even with a little bit of the fatigue and a little bit of the feeling, it's much more manageable, which turned out to be a really good thing last week when I was sitting down with the CEO and we were having a meeting, and I thought, oh crud, I really don't want to have an episode where I fall over here. This is going to be, this could be really bad, but I didn't, right? But even last week, I did have a couple episodes in terms of that prodrome, but it's manageable, right? I can function, I can keep working. It might slow me down a little bit, but I can keep moving, and I feel like I have more control over my life.
So looks very encouraging, and right now we would count you as a smashing success.
Awesome.
The interesting thing is neurocardiogenic syncope is actually common, but it's not as common to have it occur every so often like Zach's. But there are people out there, there are a lot of people who are passing out or having a hard time functioning monthly, sometimes weekly, sometimes people are passing out on a daily basis, and I'm hoping that this can be a great opportunity for a lot of people.